All right, it's time to talk with our featured guest, Mary Pham. Mary, how's it going?
Everything is going great, Michael. Thank you for having me.
No, thank you for being on. If you don't mind me asking, I know you told me before we started recording, but where are you located?
We are in Orange County, California. Our
Uh,
offices are in Orange County and Los Angeles County, actually. We're expanding a little bit.
really? Why Los Angeles?
It's still within driving distance to Orange County. So currently with our offices, we still like to be really present in them, at least visit them once a month or so. And
Mhm.
now we just want to drive, make it like a 30, 45-minute drive. And we have patients that live in LA County that want us there. So we decided to serve our patients.
What? How many practices do you guys have?
So we have 7 currently, and I think we're gonna just keep going. We're having fun doing it. So
You make it sound like so funny. Like, let's just keep going and build. And so before we dive into that, tell us a little bit about your past, your present. How'd you get to where you are today?
so initially I actually didn't think I was going to be a dentist.
Hmm.
I wanted to be an OBGYN. My parents were like the typical Asian tiger parents and wanted everyone to be a doctor. So I applied to med school. I was a med school reject. And I moved to Houston, Texas against my parents' wishes and became a Hooters girl. So I loved it. So I worked there and then I met a dentist actually at the end of my shift. And she came in, she had some chicken wings, and we were just chatting. And she was like, "You should really consider dental school." And then I was like, "Nah, I don't want to be a dentist. I don't want to be in people's mouths all day." Um, but then she was like, "All you have to do is take the DAT, see how you do, and it'll just open more doors for you. So you should try it out."
Hmm.
So I decided to focus. I took this Kaplan course and I took the DAT and I did acceptable enough to get into USC dental school. And I guess that paved the way for me in dentistry. And so went to dental school not knowing much about dentistry at all. And I did pretty well in dental school to where one of my mentors, Dr. Gardner Beal, he encouraged me to pursue pediatric dentistry because he saw during my pediatric rotation that he's like, "Oh, Mary, you're really, really good with kids. You should consider pedo." And I was like, "Nah, I'm ready to start working, make some money,
Hmm.
start my career." And he's like, "Well, let's just, be a part of the pediatric selective and just, you'll have fun. You really seem like you like it." And he encouraged me to apply to pediatrics. And then I got into pediatrics at the University of Illinois in Chicago, and I finished my residency. Me and my husband got married. He's an orthodontist, and he decided to um, settle in Orange County, and that's how we ended up here. And of course, because he's an orthodontist, he's like, "I want my pediatric dentist wife to refer me all the patients, so I never have to do any marketing ever
Yeah.
again." So within the year, I just opened a startup. And it was just like luck. We thought we were going to open in this city. It didn't work out. So at the time, you're very discouraged because you're looking at all of these locations that you think you want to work in. However, it just never, everything doesn't align the way that you that thought that it would. And so we ended up finding our first location in Placentia. The contractor was, who we're still there today, and he owns the building. And he's like, "You know what, Mary, like this is the last suite in this building. I'll pay for everything. I'll pay for you to build, I'll pay to build it out. I'll pay for whatever you need. So you just put the equipment in and it's yours." And so I did. And I didn't have much of a startup cost there except for the equipment and a little bit of upgrades and IT costs. But besides that, I was really fortunate in that I found them. And so from there, I would say within the first 3 years, we became busy. Our model is give everyone a reason to smile. And what we mean by that is everyone. No matter what type of insurance you have, no matter what your socioeconomic status is, we think that every child deserves quality specialty dental care if the parents choose that. So, we're not picky with being like a fee for service or a PPO only. We cater to everyone with the best technology and with specialty care. And so that has just been our business model. And when we realize that we're able to become profitable while seeing all different types of payers, um, it it really became something that we loved. Like, I didn't want to just serve fee for service patients. Like, how could I develop this business model that can be profitable but and also doing what I love? So that was really fulfilling. And then we started growing really fast to where we decided to open in different locations where our patients were asking us. So we just opened our Lake Forest location a couple of months ago, and I would say 80% of the patients that come through were our patients that visited another location but moved to South Orange County, to where they're like, oh my gosh, we're so glad you're here. And I'm like, you spoke, we listened. You said you guys need to open one in South Orange County, so here we are. So that's kind of where we are today. And it's still a really fun ride. I think when people start to scale, by the second or third location, they start to get stressed out. Like, what worked at one location doesn't always work with two, and what works at two doesn't always work with three. But once you get to three or four and you've systemized a lot of things, it really helps with scaling. And so yeah, it's a fun time for us. And it also, scaling allows your team to have growth opportunities. Like, if you're a single location, then you might just be a dental assistant, maybe like a lead, but then where else can you go, right? From there, if you stay there. So my goal has changed from opening one practice to how many more lives can I change? Not only patients, but my team. How can I continue allowing them to grow as we grow? Because they have been with me for so long, right? And you just want to see people succeed. So it's fun.
Mhm.
I love it.
Nice. That's a lot. You going? That was it's fantastic. It's fantastic. Real quick, where in Houston were you?
I lived in Pasadena, but the Hooters that I worked at was off of Kirby.
Oh, okay. Okay. Nice. Yeah, Pasadena over there is different than Pasadena in
Yes,
here, right?
very different.
Yeah, that's nice. Okay, so then it's interesting you said no twice, right? You're like, nah to dental school and then nah to pediatrics, but you went that way.
Right.
Why? Why do you think that is?
I think part of it was, one, it would make my parents proud that even though I wasn't a doctor, I was some sort of professional. And so that was one. And then two, I think that I wanted to push myself into a better opportunity, right? Like, I actually used to do nails. My parents owned several nail shops growing up. And one thing my mom always told me was, no matter what the skill is, you can always learn more, and that'll just make you a better person. So,
Mm,
like, I still have my manicuring license, even though I don't use it. I still renew it every year.
yeah.
And it's like, it's fun, right? It's a skill that you've acquired, that you've learned, and you're licensed to do it. And it's only good for you to learn to do a lot of different things. So now, dentistry, I don't practice behind the chair as much, maybe once or twice a month when I'm filling in for my doctors who are on vacation. But I did it for 12 years, and I really loved it. I feel like I became very good at not only clinical dentistry, but catering to patients' needs. And now I have my second calling, which is developing people and
Mm,
continuing to build my company to, affect as many lives as I can in a positive way.
yeah. No, that's fantastic. Now, I know you kind of said like now you accept anybody, right? Like, or not now, but like you've always accepted any kind of patient. Does that mean like Medi-Cal, any type of insurance, it doesn't matter?
Exactly. So we are in network with almost every payer. The only ones that we're out of network with are the HMOs that require certain criteria that we think are unreasonable. Like, for example, there's certain HMOs that say you have to try at the general dentist 3 times with failed appointments before we will pay for you to see a specialist, which I think is
Mm.
wrong because the child's, you know, the general dentist knows if the patient is able to tolerate treatment at a general dentist or if they need specialty care. Why make them go 3 times before you'll refer them? Because by the time they get to us after the third time, they're so scared. So those are the only insurance plans that we don't take, or the ones that I don't agree with their protocol or their philosophy.
Gotcha. Okay. And then you also mentioned that within the first 3 years of your startup, you became busy.
Mhm.
So break it down to us. What were you doing? What didn't work? What worked?
So initially, I thought I wanted to be this boutique fee for service practice. I think
Mm.
that's the picture that people paint, right?
Hmm.
And so whenever I was a resident, we saw every payer type, mainly Medicaid, um, as a resident. And then when I went into private practice, I thought that I wanted to be this boutique PPO practice, but then I realized I wasn't fulfilled. Like, I didn't see as many cavities or much extensive treatment. It was a slower pace, which is okay, but I like being busy. I worked at a nail shop for 15 years, right? So, I
Yeah.
mean, you have a lot more interaction with people. And so it's just a different type of practice. It's not right or wrong, but I think it's just like different dental practices in general, right? Some people like to sit and talk with their patients for a really long time. And some people thrive in a fast paced environment where I like saying hi to 5 different people. And with kids in particular, they're very impatient. And when the kids are impatient, the parents are more impatient. So
Mm.
I like the fast paced type of environment. Um, and so when I first started practicing, I worked out in Riverside County where it was like 100% Medicaid. And so when I left that practice to open my own, a lot of the patients would come and see me at Lollipop, where our practice was in Placentia. And at that time, I didn't take Dentacal because I was like, well, I don't know if I want to open that door, but I'll still see them for free. So the social worker would bring them and I would still see them, and I just wouldn't bill or wouldn't charge or anything like that. So then the social worker was like, Dr. Pham, like, we can help you. Why don't you just sign up so then you'll get paid for seeing these patients that are driving an hour to 2 hours to come see you? And I'm like, all right, we can do that. So I called Medi-Cal and they said, you can choose to see whichever patients you want, whether it's just kids under 5, special needs kids, or whoever. You don't have to take every single person, right? You can just selectively decide like which patients you want to see. And then I was like, yeah, I just want to only see my patients. I don't want to take any new patients, just the patients that I've followed for many years. And so then we just got slammed with patients because I couldn't say no to anyone. I mean, I
Hmm.
had this thing where I'm only going to see my patients, and then hey, but I have a friend, and then I'm telling everyone to come here, and we love it here. And I was like, yes, yes, we'll see them. Don't worry. Like, we'll take care of everybody. We can save the world. And so that's kind of how we got busy, was because we were like, you know what? We're not going to say no to any children that need specialty care, and we know we're the best. So we're not going to close our doors to anyone at all. If we can help them, we will. And that's
Hmm.
how we got from like kind of like a boutique PPO type practice to where we are today.
Gotcha. You're right, 100%. So many times we're like, I want to be a boutique, then I only want to have like work 1 to 2 clinical days, right? Maybe good days, and then from that point on, have an associate, be fee for service. Where does that come from? Why did you have that thought?
You know, I can't I can't put my finger on like one particular thing, but I just think people always like put Medicaid in like a negative connotation.
Mhm.
Like, oh, it's like low reimbursement, people cancel, the socioeconomic status, and it's gonna run the fee for service patients out, and then so actually what I said was, you know what, like, we're gonna be the in and out of pediatric dentistry, no matter what your socioeconomic status is, whether you're Bill Gates, if you like In-N-Out, you'll be there. Or whether you're a homeless person, you can still eat In-N-Out, or someone will buy you In-N-Out, right? And so, but there's no selectivity of who goes there. It's more of like, okay, if you like a good fresh burger, like it's affordable to everyone. So
Hmm.
that's that's where I felt like I don't know. I think just my heart is with children, and I feel like I didn't go into pediatric dentistry to just serve a fee for service type population. I went into pediatric dentistry to help the kids with the best level of care that need it the most. And if we could find a way to make it into a profitable business, then why wouldn't you do that, right?
Hmm. Mary, when did that change then for you? When you're like, okay, I did my startup, I wanted to be boutique, and then you decided, all right, now we're going to be In-N-Out. Like it felt like there was some part in this moment, maybe it was before, I don't know. You honed in, you hyper focused on exactly what you wanted to be, do, and things like that. When did that happen?
The moment that I can think of is when I had a family actually that had like two or three adopted children that were under Medicaid. And then they had a couple biological children that were like PPO.
Hmm.
And so parents told me that they would always have to take the Dentical or the Medi-Cal kids somewhere else because there wasn't like a quality dental office that took everybody that was a specialist. And so at that time, I was like, well, I don't want you to have to split up or like feel like you're not getting that quality care. And that's the comments that we get is like, oh, I've never seen a Medicaid office look like this or provide this level of care. So I think there's a stigma with like Medicaid offices is that
Hmm.
they're run down or the technology's not there or you're not getting the quality of care that you would get. But I think that we've changed that. We're like, no matter who you are, you're still going to get the same level of quality. No matter if you're a Denti-Cal patient or you're a cash patient, you're going to get the same level of quality. There's no difference in what service or procedure or products or materials that you get recommended because of your payer status. And so I think knowing that you can serve everyone. And like I said, that one family was that one moment where I was like, oh man, I didn't realize that, you had to kind of split up your family just because there wasn't one place that you could go that you were comfortable with.
Hmm. That's true. And I'm sure it means a lot for the child too. You know what I mean? And when looking back, maybe not in the moment, but like looking back, they're gonna, you know what I mean, think about it and say, oh yeah, we always had to go to like another practice that like they heard us, they did all this right, and my brother and sister they went to the nice one, right, and things like that. And I wanted to go, but looking back, they'll realize that. But so then, when it came to the Medi-Cal, do you feel like sometimes people or Denti-Cal, do you think sometimes people are like, you know what, Mary, like I want to accept it, I do accept it, and Medicare, but I either have to see a ton of patients in order to make something and pay my team, and then I don't even have time to get, you know what I mean? What's the latest technology? Let's do an admin day. Let's figure things out. Let's make our mission. You know what I mean? Or is it the kind of the other way where it's like, hey, look, I don't want to do that because I'm not going to have the time for and the money to do what I want to do with my practice.
Right. I think everyone's goals are different, right? Like we talked about before, some doctors just like to sit and chat with their patients and for quite some time. I'm the type that delegates very well. So what I mean by that is my assistants are trained to do a lot of the anticipatory guidance, the nutritional counseling, the oral hygiene instructions. They spend 95% of the time with the patient. And so I'm just going in to diagnose, verify, and make treatment recommendations. So I allow my team to really develop that bond with the patient and be the main educator because they can tell them exactly the same thing that I tell them. And it doesn't make a difference if it comes from me or from the assistant. And I feel like doing it that way empowers them too. Because I've hired some assistants who have worked for 10, 15 years, but they've never passed an instrument to the doctor. because they said that the doctor likes everything on their tray, kind of like in dental school. We are
Mhm.
the only, like, we are our own assistant. So you're used to working a certain way. And so I've had assistants that only hold the suction for doctor, and they've done that for 10 years. But when it comes to pre-op, post-op instructions, getting everything ready, informing the patient of all of these things, they've never done that because the doctor does all of that. So, I think for us, the quality of the care that you're providing, but also the patient experience is very important. And so, do I feel like the patient experience with my dental assistant doing a lot of the talking, communicating, education, does that am I still able to provide that with the same level of care as if I were to do it myself? And I do, and I think that we do. We call like a Lollipop Dental Training Academy, where we actually go through training for every single person, and like their first week, it's customer service training. So they're learning how to talk, what type of energy they're going to bring, and then they're learning all the verbiage when they come. So
Wow. Break that down to me. How does the Lollipop Dental Academy work? So the first week is customer service, and then
yeah,
every day you like, welcome, come on to the team. And
yeah.
how does it look?
Yeah, so after they do onboarding, the first week is, like I said, customer service training. It could be anything from learning all the education. There's a lot of role playing. So I'll just use a baby exam as an example. Like if you have a child and you bring the baby in for the first visit, there's a series of questions and recommendations that are asked, such as, does your child have any habits? What type of water are you drinking? And then depending on what the parent says, we make a recommendation on that. So we do a lot of role playing. So that way, every assistant is trained on not only the guidelines, but also what to recommend and even how to respond if a patient says not gonna say the wrong thing, but let's just say if it's a bad habit, like how to say that in a way that's not judgmental. So like kind of like when you go to the dentist, right? And they say, "Are you flossing?" And they just say, "Yeah," but they're not really flossing like they're supposed to. But they know that if they say no, there's going to be a lecture.
Mhm.
So there's never a lecture, there's never any judgment zone. The way that we teach our team is, treat them as if they're your bestie, bringing you their baby, and you just want to help them, right? So,
Mhm.
so yeah, customer service training week 2, we go into, I think certifications, expectations on quality.
Mhm.
So a lot of, not every dental assistant coronal polish is the same. Some of them don't do it as thoroughly. So we do have like clinical excellence expectations, and it's graded. So then they'll get graded on the quality of each thing. And then I think each week they just progress in clinical skill. And then there are expectations of customer service each week as well, meaning, did you get a Yelp review? Like week 2, you should have 2. Week 3, you should have 3. Week 4, you should have 4 that week. So they have those expectations too.
Wow. Has it ever happened where it's like, hey, it's week 4. I didn't get a Yelp for, you know what I mean? Like, are they just asking or how are they getting these reviews?
Yeah, they're just asking, like there's ways that we ask, and their lead or their trainer will help them, because sometimes people are shy, but then you have to get them into that habit of, okay, this is the expectation that you have, is you have to get 4. But if you got 1 week 1, then you know how to do it. Now you just got to keep doing it. So yeah, they ask.
Gotcha. You mentioned that you have a way to ask. How do you?
I don't want to tell you all my secrets, but but we
Yeah,
get
you
it.
got you. Okay, no worries. Okay, I mean, that's interesting though. So then, how long is that? When is the training process done?
Normally it's week 7 or week 8. All of the basics have been taught. And then it's just repetition, right? Like if you're practicing space maintainers, then you have a certain level before you get that signed off. And then once clinically the trainer feels like you are competent, it's like a competency in dental school. Like you keep doing it until you
Hmm.
pass. And then once they are competent and our leadership team feels like they're ready for the next step, and then they're we kind of see where each team member is and how they think they can contribute past just clinical skill. And everyone's different. Some people want to train, some people want to lead the team, some people like KPIs and metrics. Everyone's a little bit different.
Nice. So then, has anybody ever not like maybe like week 4, you're just like, all right, taking you out, you know what I mean, kind of thing?
Oh, yeah. I mean, there's a certain level of expectation. Some people interview very well, but then are really shy
Hmm.
on the floor. And if they don't kind of break out of their shell and meet the expectation, then we do have those conversations. Like
Gosh.
maybe you're not meant to work with kids, even though you think you are because of XYZ.
Does that normally go good, those conversations?
I always say we never let someone go as a surprise.
Mm.
So we do verbal conversations, written warnings, everything. So we set expectations, to make sure that they understand what the benchmarks are. And I think if they meet our core values, and I think that's the main thing. If you meet our core values, but it takes you a little bit longer to get where we want you to be, but we can see that there's progression, then that's more important. And maybe not, this role's not for you. Maybe we need to make a lateral move and put you in another department because you're struggling with this.
Hmm.
So I think that we follow traction with like our meeting cadence and systems, and we do what they call the people analyzer, where if we don't have clarity on whether or not we should keep someone, we just put it across our core values and see if, okay, are you kind, are you dedicated, do you have a growth mindset, do you show leadership quality, are you team player. And then if they do seem like they have all of our core values, then we say, okay, maybe they're just struggling with this. Maybe they'll do better in billing, or maybe they'll do better in this role, because we do feel like they fit our culture, but they're just a slower learner, or maybe they're not that detailed in this, but they're super customer service oriented. So maybe we can put them in a people operations role or something.
Gotcha. Okay, that's interesting. And so when that happens, let's just say, for example, they don't meet one or two core values, but you're kind of dry on that role. You know what I mean? Like or has that ever happened? I know that's happening a lot to a lot of us out here right now where we're struggling looking for team members, right? But when it comes to you where you're like, okay, we need this, they're not the best fit, but we can do for now. Do you do that or no?
So if someone's a straight no, so we do it like a plus, plus minus, and then a minus.
Mm.
So if they're like, I'll just use proactive, right? So if they're like kind of proactive sometimes, but then sometimes they're not, they'll get a plus minus, and that means we can work on it. But if one of our core values is dedication and they're like, no, because they're late every single day and they call out, then we say, okay, this needs to change right away. And if they're late for the next, you know, 30 to 90 days, I think is what they do. If they're late one time in the next 90 days, and that could be grounds for immediate termination. So we really do stick to the core values when it comes to, like, if you're not dedicated because you call out or you come in late every day. That's disrespectful to everybody that comes on time. And it's showing that we as a company tolerate that. And it goes against who we are. So we have let very good, skilled people go due to not fitting our core values. And it always ends up being that the team appreciates that. They're
Mm.
like, oh, they were late every day. Like, why should I come on time every day if they're allowing that? So we do the people analyzer, and like I said, it does give you clarity on whether or not someone fits who we are.
Gotcha. Okay, that's interesting. Now, you also mentioned that once you open the first practice, second, right, you systematize.
Mm-hmm.
I know a lot of the times we think when we open a practice number one, we're like, got it. I know the blueprint. I can do the same thing for the second one. Is that true?
No, you always have to pivot and change, because like I'll use one perfect example. When you have one location, everyone, you can probably verify all your own insurance, right? You don't really need help. You're not that busy, or
Hmm.
you've come up with a way that works. But then well, in that one location, if as you grow, it's going to put a lot of stress on your team. What we do is we say, okay, guys, what is it we can automate? And what is it that's causing you a lot of stress right now that we can help with? And from there, we come up with a solution to help with that. But I think as you're growing more locations, it's not going to be the same. Like you have more team members, you need more managers. You centralize a lot of your services, because you don't need a biller for each office. Now you can have a biller for 4 offices, you know. And so it's kind of, for me, it's kind of fun building out different parts of our organization. But there's so many things that change that I couldn't even put my finger on one thing. But I think the main thing is the people. Like the larger that your organization gets, in this example I love to use is like when it's just you and 5 people, your influence is really strong. You see them every day, you work with them every day. It's like a Wi-Fi signal, right? Like you're there and you're really in tune. But as you grow, your Wi-Fi signal gets weaker and weaker. So then you need people in place that's going to keep that signal strong. And so they say one person can effectively manage up to 5 to 7 people. And I do believe that. Like once you get to like 10, 12, 13 people, then you're not as effective in leading those people. But yeah, there's so many things that change. It's hard to just say one thing. But I think just keeping up with what your needs are and knowing that you need leadership in place to make sure that each of the team members still feel loved and cared for and engaged. And it doesn't necessarily have to be you, the doctor. It could just be whoever it is that their manager
Hmm.
is.
Yeah, I like that. It's true. The Wi-Fi, you know what I mean? Didn't they say it's like you can test it out with like a pizza party or something like that?
Yes.
Like
Mhm.
get a pizza and then however much, you know what I mean? If you're like, I need to order 2 pizzas, and that means you have too many people on your team or something.
Yeah,
I
in the
forgot what
room.
yeah, something like that. But that's awesome. I really appreciate that analogy. And at the same time, I know it's kind of difficult for a lot of people to try to systematize, right, when it comes to this. So how did you come up with it? Did you seek help? I know you said you read traction, things like that, but like how did you nail this?
So I think the one thing that really helped me the most was joining a mastermind of people who were very like-minded or better than me, right? Or like better meaning have grown their organization a lot larger and were still sane.
Mhm.
They didn't feel like, crazy yet. So yeah, surrounding yourself with the people that have that same mindset, and that have achieved more than you is so inspiring. How they say you never want to be the smartest person in the room because then you're in the
Mhm.
wrong room, right? So I love to surround myself with really growth mindset people who really challenge me to be better. And I joined the DEO, I think maybe like a few years ago. It's a mastermind group for dental organizations that are starting off. And then I've joined other groups as well. And I think everyone's tea is different, right?
Mhm.
Some people like different groups, but I would say anything that challenges you, that makes you grow, is something that is priceless, so yeah.
Yeah, I like that. Okay. And then right now with your practices, even if you could recall with like year one or your first practice, what were you doing for marketing and advertising and what did you stick with throughout this whole time?
So as far as marketing, we did a lot of just grassroots, so we would go out in the community, set up tables. We would visit pediatricians. I mean, we would go to events where our patient avatar would be, which is
Mhm.
anywhere with children, right? Or moms. And we still do that. I mean, we do a lot of preschool presentations. We do a lot of health fairs where moms are. Um, and then, as far as like spend on online marketing, we don't really do any of that. Most of it is just, I think, asking for reviews and more grassroots. And we do a lot of like internal promotions for our current patients. But to be honest, we don't spend a lot on actual like marketing.
Hmm. No, I think that's
Yeah.
brilliant. Like the ground marketing, the grassroots marketing. What when you went to these events? Well, two questions. How did you get inside of like the preschools and things like that? Like what would you say? But the second thing is like, did you have an incentive that you would offer them for them to sign up or no?
No, we just called and asked. I mean, I think there's a power in asking, like I said, asking for reviews, asking for like, hey, can we come to your school and do a preschool presentation? We'd give them little goodies like postcards and toothbrush and some branded stuff. But most of it was just being bold, putting
Mhm.
yourself out there. Like when we go to now we have two full-time marketing people, which we didn't have before. Marketing department when I first opened was me. But which I still go sometimes, but they have a lot more energy than I do now.
Mhm.
But yeah, so as we've grown, we have one social media person who goes gets content and posts everything, and then we have one person who does just PR, community events and like website. So as we've grown, we just wanted someone just strictly focused on social media, engaging with the families, um, doing contests, and yeah, it's been good. It's been good.
Mhm. Cool, cool. So then you don't like when it comes to the health fairs, right? You don't really give out any, I guess, incentives or anything like that for people to sign up.
Oh, yeah. So we do put them in a drawing, I think. Like if you book an appointment on the spot at the event, I think your name goes into a drawing for like a basket full of like dental stuff. I think like a toothbrush and all of that. But and I think we have like one of those wheels
Hmm.
that you spin that gives away swag. So
Okay.
we do like little fun things like that, but we don't have, I don't think like a coupon or anything. It's
Yeah.
just more our biggest goal is to book the appointment. So then when we
Hmm.
have our marketing team out there, their key performance indicator is how many appointments did you book?
Okay.
And that's how we know how they're
And they
doing.
normally show up, or is it like a no show, or like what's the percentage on that?
Um, I think they come. I mean, I don't know exactly the metrics, but I mean, I don't think that there has been an issue with the no-shows. I mean, our cancellation rate is pretty low because we do like a pretty good job of making sure we have a confirmed schedule. Of course, people get
Mm.
sick, and kids get sick and that just happens. But this is part of like your systems, right? And processes like how firm is your confirmation schedule being done, right? And then if a few days before you have all these holes in the schedule, how are you going to fill it? So
Mm.
we have people in place that really make sure that we have a productive schedule, like different avenues.
Gotcha. Okay, interesting. So then, if you could, from the moment, let's talk about from the moment you decided to open your startup, right? Till today, right now, what's been some of your biggest struggles or pitfalls?
Um, I wouldn't really call them struggles because I look at I feel like I am super growth mindset where I really don't stay down on something that bothers me because I think being an entrepreneur, things are going to happen. Maybe the first time, like, so I'll use this as an example. The first time I had to let someone go, I couldn't sleep the night before at all. Like I was
Hmm.
nervous, I was like crying. I wrote this long letter about how much I love this person and how I'm just so heartbroken. And then I remember when I let her go, I said, "Oh, I'm so sorry I have to let you go." And she was just like, "Okay." And she walked out the door. And I was heartbroken that she wasn't as emotional as I was. And so I think from then, like, hey, like I spent way too much time like over this breakup than she
Mm.
did, right? So I think, going back to that and thinking of like where I am today, I've realized that in order to be successful, you have to just know that things are not always going to go as planned, and that it's going to be like a roller coaster, no matter you're in business for 5 years or 25 years. There's always going to be things that happen that are not going to be the way that you anticipated, but that shouldn't predict like your like where you go, right? Like that should just be a part of the journey. Say, okay, there's going to be something that happens, like everything is smooth sailing right now, but I know in the next 3 months it could be completely different. How am I, as a leader of my organization, going to respond to any of these um, obstacles that come along the way? And so I never dwell on anything. Like if somebody leaves or if something happens, I always say, well, nobody died, right? Knock on wood.
Yeah.
Okay, how are we going to fix this moving forward so that we don't make the same mistake again? How do we drop the ball on this patient that they're not happy with us? How do we put that into our system so that way we make sure that we don't, that we dot that I or cross that T. And so we problem solve quickly and then move on. We don't really dwell on anything because anything that happened in the past, because the more time you spend doing that, the more you kind of just bring yourself down and you're not able to focus on your future. And then there's so many people that rely on you to be in that right mindset, like, yeah,
I like that. Okay. Problem solve quickly, right?
yes,
And that's, I think, I know for me, sometimes same thing, like where you're like, oh my God, you dwell and dwell, and then you know what I mean? But you grew out of it, so that's
oh
great.
yeah, fast.
Yeah, no, that's fantastic. When it comes to you feeling personally burnt out,
Mhm.
how do you cope with that?
Delegate whatever. So there's just one exercise that I do at least quarterly. I try to do it monthly, but it's really simple and it helps keep me in a right mindset. But basically, I write down everything I do from morning until night, like generally speaking. So, like, pack my kids' lunch, check my email, check my Slack, check in with people in my leadership team. And then I go through this whole list and I'm like, what is it that I don't like to do on this list? Like, what is it that I could delegate? So then, for example, I wrote right now what's on my list is interviewing doctors because I love I loved doing it, but now I get so many resumes, it's like very time consuming. But I
Mm.
know that, I mean, it's not something that I don't like to do, don't get me wrong, but it's not my favorite thing. It's kind of like
Yeah.
okay. And so then I put on here the name of the person who I'm going to delegate that to. And then I start making sure that I have another doctor on my team sit with me on the interview, start training for that position. So then I could take that off my plate. So I do get asked that a lot. Like, oh, Mary, how do you do all of this? Like, you're a mom, you open practices, you do a mastermind group. So as a hobby, I do a mastermind group too at night, a
Oh,
couple a week. And just to help other women who are having a hard time with practice ownership, right? And so, but then it's because I delegate a lot. Like I
mhm.
have a few personal assistants. I have a lot of leadership team that helps run the operations of the business to where I really don't have to be here. I could go for a few weeks and everything be fine. And it'll probably be even better than when I'm here because I have a lot to say and I take a lot of their time. But when I'm here is when the business is, that people are happy and they're doing their job, what they're supposed to do, and your business is doing well. So it allows me to focus on the things that I really like to do, because if you don't like doing something, you're taking away from things that you could be doing that ultimately are probably um, more beneficial to not only like your company but to your family, right? Because you're doing
Mhm.
things that you really enjoy. And so that's how I do it. I delegate very well, and I have a weekly focus, and the focus is always who I need to hire that week to help me with something that I need to delegate off my plate.
So are you always hiring?
Right now, it's a nanny.
Uh-huh.
No, because it could change. Right now, it's a nanny, and I actually just filled the other position, another assistant, like personal assistant. Yeah.
Yeah. Wow. Okay. So then it's interesting you say that. You have a mastermind, right? You have an organization, multiple practices, right? Teams, all that stuff you have to deal with. What was the other thing you said you have?
So I'm a mom.
Y- y-
I
You know,
have
you're a
another
mom.
child, my husband.
Okay, you he's listening to this. He's like, yeah, 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 no, but so you're doing a lot. I mean, do you ever, I guess, and I know you do. I mean, a lot of us do, but have that like dad guilt or mom guilt kind of thing, and then, or do you not?
I think I used to, but I think that every parent, right, whether they're mom or dad, has a different level of time and attention with their children that works for them.
Hmm.
So I have friends that are stay-at-home moms, and they spend their entire day with their children and they love it. And then I have some that spend all the days with their kids and they're screaming at them all day. And they're like, it's so stressful. I don't know why I'm doing this. I need to go back to work. And so for me, my kids come home from after school care or sports or whatever it is at 5 p.m. And so 5:30, 6 sometimes. And I only have like 2 or 3 hours with them a day. But during that 2 or 3 hours, it's like quality time,
Hmm.
So my my take on that is the time that you spend with your kids, that's quality time, that's good for them and good for you, means that you have that nice balance. But if you say, oh, well, this person is spending like from 3 p.m. to 8 p.m. and, on social media, they're going to all the games and they're, doing all this stuff, you compare yourself to other people, then you're never going to feel like you're enough. I mean, there's always going to be someone who's more, has more practices, who's, you know, more attractive, or who is better than you, right? Or like that you feel like you want to be like. But if you compare yourself to other people, you're always going to feel like you're not doing enough. So I just try to say, hey, you know what? Everybody has their level of work that works for them. And for the normal person, probably how much I work is going to be way too much. But for me, I love it. And I think it keeps, like, I've always worked like I do since I was a little girl. And I love what I do. So I don't feel like it's work. I really enjoy it. But when it comes to being a mom, if I were to spend morning to night with my kids, I really think that I would go crazy. I do.
Yeah, yeah.
Like when my husband's not home and I'm with them for the weekend by myself, I'm like, this is not fair. You're working and I'm at home with these
Uh,
kids.
no,
But
I get you.
yeah, so I think it's just different. You can't compare.
No, yeah, okay. I love that. I love that. I feel like sometimes we get boggled down into like what you said, that comparison mode where you're
Mhm.
looking on social media, you start comparing, you're like, huh, I should be. But then in reality, you're like, if I do it more than 3 hours, it's not going to be quality time with them. It's just
Right.
going to be,
Like,
they're going to be
stop
like,
that. What are you doing? Get down.
you're just watching them watch YouTube the whole time. You're like, all right, yeah, just watch YouTube right now, kind of thing. Awesome, Mary. I appreciate that. If anybody had any questions or concerns or anything like that, where can they reach out to you?
You can find me on Instagram at drmarypham.com or drmarypham.com, Dr. Mary Pham. That's where I met you, Michael.
Yeah.
Or my email, drmary@lollipopdental.com. Happy to help if you guys need
Awesome.
anything.
Awesome. So, guys, that's all going to be in the show notes below. So, definitely reach out to Mary. And Mary, thank you for being with us. It was a pleasure, and we'll hear from you soon.
All right. Thank you.